peer-to-peer or communities of practice meeting that we're having, and we're so excited to have Heidi join us today. She always has great information, and it's nice to kind of get that current information. We've got quite a crew on our meeting today, but Heidi is here to present. Again, she's the child care nurse consultant from Healthy Child Care Iowa and the Department of Public Health. So I will let her take that away. And then again, if you weren't on before, just type in your questions in the chat box or let us know and we can unmute you. But we certainly want to answer all your questions. Okay, Heidi, go ahead.
Great. Thanks a lot, Terry and Esther, for asking me, inviting me to do this again this month. It's always great to be able to present to the providers in the community, and just to touch base and to provide information, hopefully answer questions if there's questions. And you know, I've worked as the coordinator for Healthy Child Care Iowa for just short of 5 years. Have been a local nurse consultant since 2006. But you know, we're in unprecedented times. So we all know that sometimes things change, or we have questions that maybe haven't even been brought up before, or we need to research a little bit. So if there's a question that you have that I'm not able to answer, I definitely will follow up like I've done previously, where and hopefully, Esther, you guys can kind of keep track if there's a question. I've got a notepad so I can write things down, but just in case, feel free to always reach out to if you have questions. So I'm just, this first page here, I just wanted to share my name and contact information. So, and then also our Healthy Child Care Iowa website is a great resource for just kind of finding the child care nurse consultant map. And then we also keep the pages up to date for a lot of different health and safety needs that you might have for your program. And we'll go ahead and get started. So some of this is going to be maybe just a little bit of a review, but I did want to just kind of cover a few things that I know that are continuing to be questions that have come up. But we still at this time, we have two guidance documents that Department of Human Services and Iowa Department of Public Health have worked jointly on for guidance for child care. And those two documents that we refer to often are the child care guidance document. The date on that is from August 13th, 2020. And then also our what to do if you have a positive case of COVID. So the case child care case reporting and outbreak response document from August 6th. And those are on the Department of Human Services website. I know that they're linked also from CCR&R. They're also on the Iowa Department of Public Health links on the website. So we have those available for programs to refer to, because you know, and this is what's happened. I have calls all the time where the provider's like, okay, now we have our first case. What am I supposed to do again? You know, so it's always good to be able to refer back to those guidance documents to make sure that we're aware of all of the kind of the steps we need to take when situations occur. But I guess I want to just kind of open with the information on our child care guidance, and I'm just going to just kind of preference it with that, you know, when I say at this time, it means, you know, as of today. Things change quickly. We've had, you know, things where something will change at Iowa Department of Public Health, or something will change at the Centers for Disease Control. And so we really try to roll those changes out, working together with DHS to make sure that we have the most current information. But sometimes there's a you know, a lag. Sometimes I'll get an email and say, hey, did you see that this has come up with CDC? Are we going to change our guidance documents? And it's a process. So we just want to make sure that as of right now, these are the documents that we're referring to and using, and encourage you to just keep those in front of you if you have questions. One of the things that was in the child care guidance update was really about some information about face coverings. There's a lot of information about cloth face coverings, and I know that many programs have moved to using face coverings for staff and also for children. Now, in the guidance document, it says face coverings are encouraged for staff and for school-age children, but it's really your program's decision in terms of how you're going to implement face coverings. But I will tell you that it does help to prevent the spread of infection by using cloth face coverings for staff and children over, of course, over the age of 2. We don't want younger children to have face coverings in use, but it does help to spread infection because we know in the child care setting, physical distancing is very challenging. We know that it's hard to maintain that, what we call social distance or physical distance of 6 feet. And with younger children, it's virtually impossible. I'd say in schools, we do have more schools, and even in some of the communities I know have adopted that there's a mandate for face coverings. And so we just want to support you that there are a lot of resources, and I will kind of end the presentation with some of the resources that are out there, but there are a lot of resources around face coverings and how to best use them and cleaning and all of those kinds of things. So I would encourage that if you haven't started that, I've heard very positive things from the field saying, wow, children are really good at using face coverings. I actually was just the other day doing an observation distantly at a distance at a child care program that we were looking at some things that they wanted to put for policy in place. And so it was nice to see how well the kids do adapt to wearing face coverings. This was an older group of kids, and even though the staff were pretty good at maintaining that physical distance, it was great to see that the kids were really adapting well to having the face coverings on. So that's just kind of a little side note. Department of Human Services is really, they're not recommending that limiting those class sizes, and I'm sure you're all aware of this, to the 10 individual or less, but I still get that question sometimes, so I thought I'd leave that on there. But really, if you can, keeping those groups static is probably the biggest mitigation strategy, one of the mitigation strategies that you can help to prevent having a large number of staff and children exposed and mitigating that risk for close contact. So keeping those groups static, and when I say that, I mean, when you have a 3-year-old classroom, you keep the 3-year-old classroom as a group. And so when they go out to play, they're as a group playing. They're not mixed with the 4-year-old classroom or the 5-year-old classroom, or the staff are not mixing between those classrooms. We're keeping the group static so that, and unfortunately, this happens. I'm sure many of you have already gone through this. Unfortunately, where we have a staff person or a child who has a positive COVID test. And so having that group static really limits and mitigates the number of impacted people, staff and children, because you can isolate and say, okay, the 3-year-old classrooms, did not mix with any other groups. It was just that classroom. That one child was positive for COVID. So we're going to need to quarantine that group of children because they had an exposure and were close contact with that child. And the staff, the 2, staff members or whatever the number of staff members that were involved with that group. And so we'll be needing to quarantine that group, but it does not impact our whole center, because that's what we're really trying to mitigate, is we don't want to impact the whole center and have to quarantine multiple classrooms. That it becomes so challenging for parents. It becomes very challenging for staff and for the program itself. So I just wanted to kind of reiterate that. Some of the things that I'm just going to kind of throw out there when you think about keeping groups static, I'm really going to just kind of throw this out there, but not having floating staff, making sure you're doing physical distancing. If you're meeting with your staff, say at the end of the day, or you're having a staff meeting, making sure that you're not all in a small, conference room that you can't physical distance, and they all should have cloth face coverings on. It's so important to not have that group of individuals all combined in the same small location, because then if one staff person ends up sick and a positive COVID test, it will impact your whole staff. So that's one thing. And then also, I know you cannot, you can recommend that staff members do not socially interact outside of the work environment. But we have had some situations where maybe the groups were kept static, the staff did not interact when they were at care. However, they all socially, you know, maybe a group of them went out to eat together, or went somewhere out together, or spent time together where they weren't where they weren't social distanced, and they didn't have, you know, cloth face covering on. And then what happens is, if there's a positive case, that really impacts all your staff members. So I know that's something you cannot require, but it's something that I really highly, during this pandemic, to highly recommend that. And then I think I already mentioned kind of the joining of groups. I'd say that when I see that most often, where you're having these kind of groups of kids all join, it seems like it tends to be at the beginning of the day and the end of the day. And that's really challenging because we know that, you know, when, you know, your numbers are down and you have your ratios, you know, you're kind of joining those groups at the beginning, at the end. So, you know, trying to avoid doing that if at all possible, or at least keeping those groups somewhat static in terms of how you're putting those groups together, and distancing maybe one group to another is a way to work and mitigate around that. But reach out to your child care resource and referral consultants, because they are so great at helping work through those policies with, you know, kind of you know, how do you work with your staff in terms of getting those systems in place, in terms of your ratios and how your layout out of your rooms are. And you might have to do things differently, but really reach out to them for guidance, because they are so great at that. The other thing I wanted to just real quick is, if feasible, you know, we do want to continue health monitoring, or have parents, you know, self monitoring of the children. Best practice would be to continue the health monitoring. I know that is challenging for some programs, and if it's something that you're having some challenges with, please reach out to your local child care nurse consultants to help with that. But we do know that health monitoring with daily temperature checks, and with asking those questions if they've had a potential of some symptoms of COVID, has been effective for keeping kids that are ill out of care, and keeping staff out of work that are ill, so that we're not having those close contact infectious disease spread, which we're really trying to avoid. And then for symptomatic staff and children, they really should get tested. Test Iowa will test over the age of 1 for children. Staff and children are listed as a priority group. So if you go on the Test Iowa site, and the staff member writes in, you know, puts in the algorithm, when they're entering their data, they'll put in that they're, you know, they work with children and they're in the child care field. They will get a number then to go for testing. So they are part of the priority group. So, you know, we are still following our isolation guidance. That is the CDC isolation rule, that if somebody has tested positive and have COVID-19, then they need to be isolated. And I think, you know, we're really looking at those positive results, but when people are ill, when staff are ill, they're going in for testing. A child is ill, they've gone in for testing. They need to be isolating it pending those test results. Okay, so if they get those test results and they're able to return to care, you know, because they have symptoms, and then they test negative, and their symptoms resolve, and they are able to go back to care sooner. But the current isolation rule is that you can be around others after 10 days since the symptoms first appeared, and 24 hours fever-free without fever-reducing medication, and overall your symptoms have improved. So that is, I know, challenging, but we do follow that isolation guidance, and that is still the current isolation guidance that we have on our handouts. I'm just going to be, you know, just kind of let everybody know that Department of Human Services and Iowa Department of Public Health, they are aware that the child care guidance documents around some of the information about exposure and isolation guidance is not aligning as well with the Department of Education's and Iowa Department of Public Health guidance document that they have for schools. And so they are aware of that, but at this time, child care guidance is going to maintain what we have in our handouts at this time, that could change, just so you know. But it's just, I think, I know that's concerning for providers. I know that's concerning for parents. We've heard that. It's challenging when we have a parent that says, well, my child can go to school, but because according to their guidance document, they're still allowed to go to school, but my child can't go to childcare because it doesn't match what Department of Human Services guidance document says. And we are aware of that, and that has been brought to the attention of Department of Human Services and Department of Health. However, we also know that school settings are different. For one thing, school settings are different because you can physical distance a lot, and socially distance, and maintain that 6 feet space with older children. It's more feasible, more challenging in childcare, so we know that. We also know that schools are requiring face coverings for most schools are for staff and for children, and so there is that added level of kind of mitigation that's been happening with wearing face covering as well as physical distancing and socially distancing that 6 foot between children and between staff. And so their guidance document is really based on kind of that situation with schools. And our guidance document is really based on childcare, which we know is different. So just so that you know that we're aware of that has been brought to attention, to the attention of both DHS and IDPH. And like I said, things could change. So just so you're aware. Just real quick about the case reporting and outbreak guidance. The Department of Human Services and IDPH works on that guidance document, and we follow that whenever there's a case. And we really are looking at that confirmed positive case. So I know sometimes we'll have, well, the child was ill, they're not in care, but do we need to start looking at close contacts for that child, or do we have a staff person who's ill? We don't start doing those close contact and doing the quarantine and all that until we actually have the confirmed positive result, because we know that sometimes there's another situation going on where the person's symptoms are not, they end up with a negative result of COVID. So we really follow this guidance when there's positive, confirmed positive results. And then with the case reporting is first you would be reaching out to your DHS licensing consultant. They would collaborate with your local nurse consultant, and also local nurse consultant then would collaborate with local public health. So there's kind of this collaboration between kind of the 3 entities to make sure that that those close contacts and that quarantine is happening for 14 days, and it could be longer depending on the scenario. And that you really want to work with your local nurse consultant and make sure that you're kind of, what mitigation strategies do we have in place? What could we maybe improve on so that this doesn't happen again? So really looking at those, what to do when you have a positive case. Now, if it's an outbreak where there's 3 or more confirmed positive cases, and that would be either with staff or child or combined, and not a household contact. So if it's 2 siblings and a staff member, that would not go to an outbreak status. An outbreak status would go to when there's actually 3 confirmed that are not of the same household. And then that's kind of when I get involved, and I will be tracking that and working with Department of Human Services. Of course, you first report to the Department of Human Services licensing consultant. They reach out to me, I track it, because we're really looking at that outbreak. How much is it spreading to other individuals? And then, of course, local public health will be directing the programs in terms of the quarantine, what they might make recommendations in terms of, is it at a point where it's just unsafe to have the program stay open? Our goal is to not have programs close when there's positive cases and outbreaks, and our goal is to not have to have as limited number of impacted individuals as possible. So keeping those groups static and only having to close, maybe have a classroom where everybody in the classroom was quarantined because they were the close contact. So we're going to close that classroom, and we'll close them for the period of the 14 days while those close contacts are all in quarantine. and then we'll be able to reopen that classroom. That's what we're really trying to work through, and that's the information that when you work with your Department of Human Services licensing consultant and with your local CCNC, they'll kind of help work through that with you, as well as local public health and myself, of course, when it's an outbreak. The CDC has some really great quarantine scenarios, and they have calendars. I know I brought this up before, but if you haven't looked at them yet, I put the link in there. I pull it up. I'll tell you, I actually get a calendar out, because when you're counting out the 14 days, or if it has to be longer, and the reason that would be longer is sometimes what happens is, especially when it has to do with a child, like a staff person, and it's their own child that's positive or something like that. The 14 days is really from the last time they had close contact. So as you can imagine, in a home setting, that is challenging to not have close contact during that infectious period. So that's where we really work with local public health to say, okay, the last time they had close contact with the individual was here. And so this is where you start the count for the 14 days for quarantine. So that's a little tricky. Each situation is so unique, and that's what we're here to help, to kind of walk you through that. So local nurse consultants are familiar with our quarantine scenarios, as well as local public health and myself. So we're here to help kind of go through that. So I know that question comes up a lot, where I'll have a provider say, okay, so, what day do I say I can open back up, or what day can I open that classroom back? And I wasn't quite sure where I start counting from, so we'll help you through that. And then, during that quarantine period, I think it's really important that families and staff are aware that during that period of time, they really need to make sure that they're monitoring their health, because that's where we're kind of looking. We're in quarantine for the purpose of, you've had an exposure and you're looking to see, am I having symptoms? And we know that symptoms can be mild, and we've had a lot of reported cases of mild. So I do, recommend that, and that's in our guidance document, that if you're, you're close contact and you're starting to develop some symptoms, and it could be very mild symptoms like runny nose and, not feeling very great, maybe a little achy, maybe a headache for a couple days. That's the kind of things that I've heard from people. And then we say, well, did you get tested? And then they get tested, and guess what? They were positive. So now we have another case of your, program that now is reporting a positive case. So it's really important that they're monitoring for those really mild symptoms, because we don't want them to come back too soon. That's the whole purpose of that. We don't want a close contact who's now developed positive symptoms. They haven't gone to test, so we don't really know they're positive, and then they come back sooner, and then guess what? We have another exposure, which just now prolongs the amount of time that people are in quarantine. So it can really, we want to try to stop it with that first exposure. So I hope that makes sense. And like I said, sometimes, it's a little confusing, but we're here to help. I did want to just, our Healthy Childcare, our website, we have the kind of the printed products section of our tabs kind of on the one side from our website link. And then in the printed products section, which is where we have like our action plans, we have our med sheets, we have our child health forms, injury form, all of those things are there. But we do have a COVID section. So the COVID section is where we have all the links to all of our, either the guidance documents themselves, if they're PDFs, or to link to the guidance documents. So like we have some, I even have the link on there for those quarantine scenarios, because I think those calendars are really helpful. So so those kinds of things are there right there on our website, and also linking to DHS and linking to CCR&R. I'm going to switch focus here for just a minute, and this is because this has really come up just this really over the weekend, to be honest with you. It kind of started at the end of last week, but we've had significant storm damage from, it's almost been a month ago now since the storm, I think, went through. You'd have to look at the date. But I think having all of the rain that was last week has really caused some additional problems for people that have had storm damage and then maybe some health concerns. So I had a couple calls from a couple different areas of the state where, they said, well, we had some storm damage. With some roof damage, we had a tree limb down. It, was affecting our, our eaves trough on the one side. And then with all this extra rain, now we've got water that's come into our foundation, and now it's been enough days, and now we have mold growth on our walls. Or I had a call from a provider where they had some roof damage. They were waiting for the repairs on the roof, and then because of all the rain over the weekend, their ceiling came down. And they had asbestos now that was in there. They've had some testing done, and it was asbestos from the attic, from the roof coming down. So I bring this up because I would say the three things that you really need to be thinking about is mold, lead paint, and asbestos. Because when anything's wet, mold is such a problem. And with all of the rain that we had last week, in pretty much throughout the state, many areas of the state had a lot of rain and pooling water. And then if you also had some storm damage, with maybe some challenges with drainage or whatever from your facility, if you are seeing mold, that is really a health concern for yourself as well as the children in care. Also, lead paint can be an issue because if you have, wet window areas, you've had moisture, you've got maybe some mold, you're going to clean that up, and now you have peeling and chipping paint in that area. Is there a concern of lead paint? We know that is, for any programs where their building is, prior to they really say the cutoff is 1978, but anytime prior to that, there could be a potential for lead paint underneath those layers of paint. So your top layer might be fine. It's now you've got water or moisture, and now it's peeling, and now you have multiple layers exposed, and it's that underlayer of lead paint from maybe the original time that the window wells or window areas were painted. And then asbestos would be another concern, for more structural damage. There are resources for these health concerns, and I wanted to share those with you. So if you haven't been on the Iowa Disaster Recovery website, this is the link, the disasterrecovery.iowa. .iowa.gov. And right on that first website, there are some helpful tabs, and really under the community resources area, and that's why I kind of did a screenshot of this. There are, for each community, there is a link you can click on for your community. So I think that would be helpful to maybe look at that discovery or disaster recovery page. There are contact information. I would always say to contact FEMA if you had damage. I think it's good to start with FEMA. We have FEMA assistance available. And if you have families that are telling you about situations they're involved in, really directing them to this page. They also have a Facebook group, and I was on there the other day, and they had postings of, community groups that were passing out free fruits and vegetables, garden vegetables. They had, community group that was said that they had some, some items that maybe people, could use. So their Facebook group was very active with a lot of different posts about assistance and help. So that would be great for you guys to link on that, follow that. I actually, because of those phone calls that happened, and Mary Jansen actually was also involved in one of the phone calls. I did reach out to Ryan Page at Department of Human Services, and we're actually going to be getting working with CCR&R to get kind of a constant contact out. It'll be coming out probably tomorrow. I mean, it'll be this week. We're working on that right now with kind of this list of some of the resources. So you're seeing this first, but we're going to do, CCR&R is going to put some information out there. So that's going to be shared statewide, which I think, in your area you have some damage, but there's other areas of the state also that are still having damage too, or having some additional damage because of the water last week. So this is a great place to start, is this website if you haven't been on that. And then also looking at those community resources, because your local public health office or your local environmental health department can be helpful for kind of steering you in the right direction. Say you're having a concern about lead paint. There's a website that they would direct you to for lead concerns at the Iowa Department of Public Health, or locally they might have some resources that they can provide. For mold, there is a really great handout, and I'm going to switch to the next page, and that's on the CDC website. So this actually links from that Iowa disaster recovery page over to the CDC, cdc.gov / disasters. Has some great information, and I would go to kind of the flooding section, because if you're having mold or like the lead paint issues, water flooding is kind of where you might want to kind of go to their page and look at that, but you can look at the whole disasters recovery page. They have a lot of helpful hints, but there is a homeowners and renters guide to mold cleanup after disasters. That's a really good handout, and there's some infographics also on how to clean up mold so that it's safe. And we just want to make sure that you as a program, if you're, and I know, it depends on the program. Some programs, have a maintenance department. You could direct them to this page. Some programs maybe would be hiring someone to come and do some remediation if they had some structural damage and needed some painting and cleanup. I also know there are some programs that would be them. That would be the director and the staff maybe working on what the issue is. So I wanted to share this resource because this is really helpful, and it will walk you through the steps on how to clean up mold. And I think mold's probably the one that I'm hearing more concerns about. The ones that I've heard, they have mold growth, and it happens quickly. I don't know if anyone's ever had that happen at their own home or in their own facility, but a few days of wet weather, if you don't get it dried out, you start getting mold and you'll see it. So so this is a great guide to work through. And also, your local nurse consultant, you can contact me. We will direct you to resources. I guess the one other thing too I was going to just mention, as I did have a couple questions about playground safety post the storm, and most of the playground questions that I had heard were related to like tree limbs falling down on fencing or outdoor playground equipment. I had some questions on that, and then questioning, who to contact to do an inspection. So I did talk with the National Program for Playground Safety, which is based out of UNI, right? Heather Olson runs that program here in the state, and they're a national program, but they have some helpful guides on their site, and they also have a contact us. So if you have some specific questions, but they do have a link for playground inspectors. But I did hear that because of the extra flooding that some programs were having, so they were concerned of, now are our footings strong enough for our playground equipment, because we've had all this moisture and we had a tree limb that fell down. So I think really reaching out to NPPS to look at who the playground inspector is for your area, to see if they could come out and take a look at your playground. Also, reaching out either, like I said, to your local nurse consultant too, can help you with that, or reaching out to me if you have questions about that. But I know that was a question that came up. Just wanted to show the map for your area. That's our CCNC map and contact information. So you can go to the website and pull up that map and get their current contact information on their website, or their email link, as well as their phone number. And of course, you can always ask CCR&R. If you have a question, you can always reach out to CCR&R too. They'll direct you. And then that was what I had for now. I did not see any chats pop up, but I might not have seen those. So if you have any questions, I'm open for those.
Heidi, there is one question in the chat box. It's kind of a two-part question, I believe, and I'll ask it if we need further clarification. We can unmute this person. It says, are we still to be washing nap items daily? We are, just checking. Also, what about children bringing items like book bags? So I think there must be some concern about bringing items into the center as well, or the environment.
Yeah, that was, we've kind of at the beginning, we were really, concerned, and we're still saying, limit the amount of soft surfaces that are being brought in, that, we can't disinfect. Now, we do know that children are bringing their book bags. I think it's important that they're bringing those book bags in, and if they're bringing them actually into the classroom, that they're in a cubby hole, cubby system, so that they're not being on the desk or in an area where other kids are, because they're difficult. Most often, I'd say most backpacks, book bags, those kinds of things are soft surfaces, and to be able to disinfect those, that's very challenging or even impossible to do that. So we want to limit the items that are brought from home, but we do know that book bags are being brought in now, especially now that school's back in, preschools are back in. That's a way we use book bags to communicate back and forth with parents. So just making sure that they're just kind of just limited for their own child's use. And of course, the important thing, if they're putting stuff away in their personal backpack or getting stuff out, they really should be washing their hands or using hand sanitizer before they're coming to a group activity. If they're, I think it's just using those, kind of going back to those basic, preventive measures for all infectious disease spread. But definitely during COVID, we're more attuned to that, of course. And then the other thing about washing the nap items daily, that's something that, depending on the program, and I can refer you to the Appendix K. That's still the CDC is referring to the Caring for Our Children Appendix K. And if you want to reach out to your local nurse consultant, or if you're in an area where, I know we have one area that's has a vacancy for their nurse consultant, so I've been handling those contacts. But following that guidance document, that nap items, it all depends. Every program's a little different. If there's any contamination where nap items would be touching another child's nap items, then you should be, at the end of the day, you should be just washing those, so then you don't have to worry about that. But I do know some programs that have a different situation where they can keep those nap items secure, so that they're not potentially being spread. And the reason we say nap items is we know, COVID is spread through saliva. If a child is wearing their face covering during the day, they take those off at nap. So, there is a potential that's one reason we also say not to do water play right now, because children tend to like to, maybe if they're scooping water with a cup, they might try to drink out of the cup. And there is a potential for, the saliva, to be a potential for contamination for a surface. And then that could potentially spread the virus to another individual. So every program's a little different on that, and I would just refer you back to that Appendix K. I think I saw another question pop up.
Yeah, there's a few more, Heidi.
Okay.
And maybe if it's easiest, maybe one is from Chad. He kind of had a question and had a clarifying question. So I might just unmute him and see if he wants to ask that question.
Hey, Heidi.
Yeah.
The questions I had, at one time I was recommending, because CDC was recommending it, irregardless of a child being positive for COVID or someone, that child remain home symptom-free for 72 hours before coming back to either a center or a home. Is that still what we're following, or is that just a recommended, not necessarily we have to follow required guideline?
So the Department of Human Services guidance document still says that children who are ill should stay home, children who have parents that are ill should stay home, and staff should stay home. So I guess we're kind of on the difference between when we start talking about a case and we're positive, we're looking at a positive case, but we are still best practice and following the CDC guidance is that children who are ill or staff who are ill should not be in group care. And the recommendation for for them would be to get tested to see if their illness is COVID or not. If they choose not to be tested, then they really should not return for 10 days. So it's not 72 hours or, it's 10 days. So if they were tested, they were symptomatic of COVID symptoms, they're tested and they test negative, then they can return. And originally we had said 72 hours fever-free, and that has changed to 24 hours fever-free without the use of fever-reducing medication. But it is still that 10 days and symptom-free. So I know that's challenging, because we know this time of year, kids are sick, kids have different things going on, but we are moving into, I've heard of some cases of strep, I've heard of, we are moving into influenza season. We really don't know. And if they aren't seen and get tested, I mean, it would be no different than a child who had symptoms of influenza. They would go to the doctor's office. The doctor's office would test for influenza, and then they would be waiting for those test results before they were returning back to care. So I think we need to continue to follow that guidance document.
So sorry if it's just so confusing, and it changes all the time. So
no, it is.
Let's say a hypothetical scenario, we've got an in-home provider. We've got a kid that just has a fever. Okay, let's say, which could be a symptom of COVID.
Yeah, could be.
Kids staying home for 72 hours or a negative COVID test?
No, they actually would need to stay home for 10 days. So
10 days, irrespective of if they have COVID or have been tested for it or anything, correct?
Well, if they are tested and they are tested negative, then that's when they can do the 24 hours.
Okay.
Fever-free without use of fever-reducing medication.
But
so
if they're not tested, it's 10 days, correct?
Right. If it's not tested, we go to that. It's kind of like the 10 and 24 rule. It's 24 hours fever-free and 10 days, and it's and symptoms resolved, which is a long time. That's why we're recommending to get tested if they have symptoms. It's not the same if they're asymptomatic though. So that's a totally different situation. If they're asymptomatic and they're concerned that they have COVID, they really should be quarantining for 14 days. So.
Okay. And then obviously, just to clarify, we get a kid with a positive COVID test, them and their whole entire family are isolating for 14 days.
Well, they're close contacts. So that, every situation is so unique. I would say in general, it's the family, but we do know that every, family situation is unique, and we are not, right now, the DHS guidance document is that, if the child is, or if say the parent is ill and the child should stay home, if the child is test positive, I know that they'll do the close contact. Generally, then the parents would be quarantining, because they're a close contact. But I do hear different situations where local public health might say, well, we need to quarantine this group, but there might be a sibling that is older, wasn't, maybe is a teenage sibling that wasn't interacting with the child during their infectious period, or they have a young adult who was home from school, from college, and they were home during these days. So public health will actually walk through that exposure potential with that positive case, and then determine who their close contacts are for quarantine. So it's kind of not in general, 14 days quarantine for anyone who's a close contact. That may be their whole family. It may not, depending on the situation.
Right.
Does that make sense? Hopefully that makes sense, or I'm explaining that. But I refer to local public health on that, because when they start doing contact tracing, they will be directing the family of who their close contacts were.
Right. Well, and where I've seen a couple of situations that have happened is so let's say I've had a family member of that child, let's say dad comes home sick. He tests positive for COVID. They still take the kid to daycare. And so now you have potential exposure at the daycare home. And so I'm trying to relay to my providers, hey, keep kind of touching base with your daycare parents, health situation, because if somebody in that family, chances are they're going to have had close contact with that sick family member, and they just need to keep the entire family home for 14 days. Otherwise, then you risk shutting a daycare home down for 2 weeks because that child now potentially could be COVID. We haven't tested that child yet, but they could have exposed that entire daycare home to everything. So.
Yeah, that's correct. And so that's why it's really important that, that guidance document is just, and it doesn't say COVID positive, it just says if the child's parent is ill, the child should not be in care. Okay. I mean, that's, and that's where I would say with a mitigation strategy is having those questions being asked when you're doing your health screenings, and whether that's, they fill that out online, or you ask that question before they enter the building. I mean, everybody has their own system on that, but really screening for those questions, is somebody in the home ill? Because unless they've been tested, we really don't know. And we'll be running into a season where we're going to have other potential illnesses going on too. So having those policies in place, I think, is really, and that's where I would say, reach out. Your local nurse consultants can help you with that policy guidance to really help get that policy in place of what they're going to put to the parents. It will, to get that kind of structured. So if you're a program that hasn't really done that yet, work with your local nurse consultant to get that policy kind of in place. And we look at that CDC guidance. They have some great guidance on that. I hope that was helpful, Chad.
Yeah, no, it was. Some of it was confusing, but I'll try and sort it out and talk to CCNC too. I mean, it just, again, it changes, I know, and CDC recommendations change. And
it does, and it could change tomorrow.
Right, and that's what's hard, is giving daycare providers advice when, okay, let's try and look and see what the latest, recommendation is. So,
yeah. I think did I see some other questions pop up?
You do. There's a few more that have popped up. So the next one that popped up was from a center that said non-COVID illnesses. What are the guidelines? Are they back to normal?
So because, there is quite a list of COVID symptoms, I mean, I think it'd be really important to look at that list to make sure, these are the kinds of questions I've had is, the child had strep, so can they return? And the problem is sore throat is a COVID symptom. And so, the child goes to the doctor and has a strep test, but didn't have a COVID test run. I mean, my recommendation is if they have a symptom that's on the CDC COVID symptom list, and you can Google that, or there's a link on our website to that main page of COVID on the CDC COVID page. And also the Iowa Department of Public Health has the symptoms listed too on their page. You're really going to need to follow COVID recommendations and not follow kind of our normal exclusion criteria. Now, we do know that there's other illnesses that do not mimic COVID. So then, of course, you would follow those exclusion criteria for those illnesses. But unfortunately, there's a lot of our common symptoms that kids have with illness are very similar to COVID when you really think about it, especially because a lot of our illnesses include a fever.
Which maybe you've kind of covered this, but I'm going to ask it anyway. This is another question that says, if a child tests positive for strep throat, do they still need to get a COVID test or be home for the 10 days plus 24 hours, even with a positive strep culture?
That is the guidance recommendation, is that because they have a symptom of COVID, that they would follow the 10 days. So it's not 10 days plus 24 hours. It's 24 hours fever-free without reducing medication, and 10 full days from the symptoms when they began, and then that their symptoms have resolved. I know that's challenging for parents. That's why I know a lot of health care providers. I talked with a provider a couple weeks ago. They're looking at doing kind of a triple test where they do strep, the influenza and COVID, kind of do a triple test. So they kind of rule out all of them. And so that would be the recommendation, is that you would follow that. It is your exclusion policy, though. I will go back to, these are, we have a guidance document from DHS and IDPH that says if a child is ill, they need to stay home. If their parent's ill, they need to stay home. If a staff member is ill, they need to stay home. In terms of, and then we recommend following the guidance document from the CDC, which I will tell you is a good mitigation strategy, because if you allow a child back into care and they actually never were tested for COVID and had symptoms, they could potentially expose your whole classroom when they, and then you'll start having cases. We've had it happen. So that is best practice, but it is your exclusion policy. I do know there are a lot of programs that are really struggling with this right now, I will tell you. I know it's a struggle, because normally we would say, if a child had strep throat, they would come back after they've had their antibiotics, 24 hours fever-free, and they've had their antibiotics, and they can come back to care unless they're, actively drooling or having other challenges. So good questions.
Yeah. Okay, there's a couple more that kind of popped up. One was if its staff tests positive and has been wearing a mask, is that taken into consideration and applied to exposure to others? So pretty much if staff wears that mask and is positive, is there any considerations for that?
Really, they look at close contact definition. So a mask in itself is not going to kind of mitigate that close contact. So when local public health is doing the case finding and they're looking at who that staff person had close contact with, they will look at who they were within 6 feet for 15 minutes at a time. Masks do help to prevent the spread of disease, depending on the layers of cloth that are part of the mask and what type of mask, and if there was gapping or not gapping, or if it was wet or not wet, but it's not taken into consideration from what I understand from local public health when they're doing contact tracing. Very different than if they were in the hospital setting. In the hospital setting, they would be using a different type of mask, as well as a lot of times they have full gear. So then they do look at that differently in the hospital setting.
There's another one. Is it true that if you feel you've been exposed to COVID, that you wait the 5 days to be tested in order for the body to develop the antibodies that'll show, so it won't be a false negative?
I haven't heard 5 days before. That's not something that I've been aware of. Usually if you're showing symptoms, they always look at 48 hours prior to symptoms starting, that you could have been shedding the disease at that time. When you go to the Test Iowa site, or if you've talked with your healthcare provider, they will ask like when your symptoms began, and they will give you a time period of when testing would be best to try to pick up that virus spread. But when you're having active symptoms, usually, they would have you come in to have that test done. So I've never heard the 5 days, and I'm sorry, I'm not part of the testing part, so I could be wrong on that, and maybe one of the other nurse consultants who work for local public health could chime in if you know for sure if there's some kind of, but I haven't seen that. So.
Okay, that's all the questions that I see in the chat box right now. Does anybody else have any questions or anything to add?
Great questions. It's just trying to work through all of it. And it is ever changing. We're trying, I will say again, I know I probably said this last time, thank you for your flexibility because we have to be flexible during this time. Oh, I think I saw another chat come up here.
Yep, one more. Does contact tracing happen automatically with a positive case?
The contact tracing is done when there's a positive case, and that's why that's reported to local public health. So there is a process where they would get that positive case from the lab, but to prevent that delay of waiting till that lab reports it, we always say when you have a positive case, and so if a staff person or a parent calls you and says, my child tested positive, you would contact DHS and or your local nurse consultant or the DHS licensing consultant or registration consultant would contact the CCNC, and then their role in that first case is to contact local public health to alert them that that's happened. Then they can sometimes they can catch it sooner. That then they'll start doing that contact tracing right away. But sometimes if it's waiting for the lab results, if we don't know about it, sometimes there is a little bit of a delay. They have to report those positive case like pretty much immediately. I mean, as soon as they get those in. So, and that goes to local public health for them to do that contact tracing. Great questions.
Yeah, there is a lot of information, and it's hard to navigate everything. So of course, your best resource is your local nurse consultant. Reach out to them when you have questions. Does anybody else have questions right now today that they want to pop on and ask or type in the chat box? I know we're just about 2 o'clock here.
I know, it just goes fast.
Yes, it does.
I guess overall, I would just like to say, thank you for participating today, and thank you for all of your partnership and support. It definitely is a team approach, and I really am, and so pleased to be working with CCR&R and with Department of Human Services to really have this team approach so that we can, we've been very successful with keeping childcare open in the state. I know other states have not been able to do that, and so that's been really challenging for families, and I know it's been challenging for us, but I am very proud of the work that we're all doing to support and the child care providers really working with all of us to support children and families.
Perfect. Well, I just want to remind everybody to continue to be aware. Don't relax your rules or policies. I know it's been a tough, long road for the last few months, but it doesn't look like it's going to end anytime soon. So we want to make sure we continue with that. A reminder, our next Communities of Practice event that we're going to have with Heidi is October 6th. If you want to mark your calendars for that. And the one in November is on the 17th. So we want to continue these monthly for a little while, knowing this information is vital, and we need to have those reminders, especially when things change. So if you have further questions, make sure you contact your nurse consultant or reach out to CCR&R, and we certainly can guide you the next direction. If you have other topics or information you would like to have shared or brought to these meetings, make sure you reach out to us. We'd love to have that information. A reminder too about those DHS monthly stipends. If you haven't got your September one done, get that in. This is recorded, so we will send it out and it will be on our website. So thanks again, everybody, for your time. Nobody has anything else. We look forward to seeing you next month.
Thanks a lot. Have a good day.
You too.